First of all, I would like to ask you both permission to use this video for educational purpose and on the
Yes.
internet.
Of course.
Now, tell me first about your life and your symptoms before the surgery.
I had so much back pain, and I really was limited in how far I could walk. I mean, I couldn't even walk a quarter of a mile.
Mm-hmm.
And it was constant pain, day and night.
Back, leg,
Back,
and
back,
the leg?
well, it's kind of now like I don't remember exactly. It was so
Mhm.
bad in my back.
Yeah, my note before the surgery said that you had some pain here.
Pain in there.
and
Okay.
here.
Well, you remember.
Yeah,
then.
I write it down. I don't remember really.
Okay.
Now, what did you notice about her life, her complaints
Her
before the
life
surgery?
had gone into a little bit of a hole because she really couldn't walk at all.
Mm-hmm.
We lived in an area where walking was quite easy to do,
Mhm.
and she was virtually homebound because she just couldn't walk.
How long? Was she like that?
I'm thinking of the last couple of years before
Couple of
the
years.
surgery.
Yeah.
Yeah.
So, and obviously, may I ask how old you are?
I am 76.
Now, many of our colleagues, they really hesitate to do a big surgery for somebody in your situation.
Right.
And I'm going to my note, and my note says that you had quite significant scoliosis with side bending of the spine, with significant bending and twisting of the spine. And did you talk to any other surgeon regarding this problem before?
No, I was fortunate. I knew I needed to have it done. I didn't know where to go, but then Dr. Stainer
Mhm.
said,
You should look into
he's
us.
at the chronic pain clinic,
Yeah.
and he said, you have to see a bossy. I want you to see a bossy.
Thank you.
And
Well,
so I did that.
and we did the surgery just 6 months ago.
Yes.
Let me show you what we did, because I think to understand, now you had what we call double scoliosis in the thoracic and lumbar spine, so practically every level is bad. And many of our colleagues in a situation like that, they say fix it all or don't do it at all. And for lots of people your age group, it practically ending up being just live with it and don't do anything at all.
Oh, I
And
couldn't have done it.
Yeah, I can imagine that. And here are the pictures. You see, the screws are well positioned. They are, we are, and your spine has significant twisting as well here, as you see here.
I don't know how you dealt with it, really.
Well, I just used this machine to show me where the things are, and
Okay.
I literally put the screws with 2 C-arm that enable me. Now, in the area that we did the surgery, we corrected more than half of the side bending, but not all of it.
Okay.
And that's another thing
But
that
you got the worst ones.
we got the worst
Yes.
one, and we corrected most of the side bending, but not all of it. And
Okay.
again, this is like trying to give you the maximum benefit with the smallest possible segmental, we call surgery.
Right.
Because alternatively, is a much bigger surgery.
Oh, I know.
But because of your overall situation, you may not qualify for that.
Exactly.
Now, again, we did not fix everything, but how are you?
100% better. I mean, life is back.
So, what do you observe the difference between before and after?
Without question, it's much better.
Yeah,
much
walking.
better.
How is walking?
Walking is fine. I need some physical therapy. There's no
Yeah,
question about
yeah.
that. But
But the back pain, just the pain that you had in the back and the leg, how is that now?
it's not 100, especially if I abuse it, I'll
Mhm.
get some
You
pain.
notice that.
But normal, no.
What number would you give to the pain now? It was before the surgery. I just checked it out. It says about 8. How is it now?
1, 2.
1, 2.
Yeah.
And we are just 6 months out.
It's
We have
not
still-
enough to even think about it, you
No,
know.
Good. Well, let's don't think about it, because that pain is what's keeping you out of trouble.
Exactly.
That pain is when you do too much,
Yep.
keeping you out of trouble.
Yep. I hear you.
Yeah, and now overall, this is the purpose of this video, is to show that even in a difficult situation, if you put the bar that we want to fix everything, sometimes we end up fixing nothing at all.
Nothing. Yeah.
But if we just see what's the worst
The
level
worst ones. Yeah.
and just fix that segment,
Yeah.
it
And
ends
that's
up
what
really
was causing all the pain.
well, at
that
least
one.
most of it.
Right.
Yeah.
Yeah.
And and that is truly worth to fix just
Just
those
that.
areas that it give
Yeah.
you most of the
Well,
pain.
it certainly made a huge difference.
Okay.
It's amazing.
Well, any other question for me or comment?
Will you
I-
give a physical therapy script?
Exactly. That's exactly what we are going to. We are going to. Now we are just starting to recover from that and putting you back. So we have a long way to go, and the situation in general will get better than it is even now.
Oh, good.
Okay. Now, having said that, we didn't fix everything, and I hate to say that I didn't make you younger. So
You didn't make me younger?
no,
Right,
I
no.
did
Darn
not.
you.
I know. But I'm very happy with the results so far. Both inside bone is growing, and outside the skin is healing, and your symptoms are significantly better. And we can show that we can truly again and again deliver this result with the what we call segmental correction. We don't have to fix everything
Right.
to give you the benefit you need.
You
Okay?
know, the recovery was nothing.
Tell me about it. How was it?
It was just, I was so much better. I didn't, there was no post-surgical pain and angst, and
Yeah.
it was just, everything was so much better.
And even though it's still this was a big surgery, 3-level fusion.
Yeah.
Right.
So
But you were so available, and that was
Yeah.
the other big issue for me, that some people do the surgery and then they're no longer available to you, and that wasn't the case with your good care.
thank you. I really appreciate that, and that I hope it helps as well many of my patients who have been told you need this big surgery, and they're
Well, you
scared.
don't know how many people I've told, before you do anything, you need to see Dr. Abbasi.
Thank you very much. That's the best compliment any surgeon can get. I really appreciate that. Okay, and thank you very much for taking care of
Thank
each
you.
other.
Yes,
Okay,
good to see you.
thank you.
You